I now have the pleasure to introduce our 2020 Nurse Honorees who are receiving the Inspiring Global Nurse Award for their extraordinary work. Because we're doing this virtual, it was necessary to shorten their impressive bios and stories. So please be sure to visit nurseswithglobalimpact.org to see and read more about each one of these incredible nurses. So let me begin. The first one, Margaret Barton-Burke, has been nominated by Memorial Sloan Kettering Cancer Center. Dr. Margaret Barton-Burke is an expert in oncology and a visionary leader in developing research and educational initiatives for nurses around the world. A natural collaborator, Margaret has developed partnerships and scholarship in the United States, Africa, Australia, New Zealand, and South Korea. Margaret is the Director of Nursing Research at Memorial Sloan Kettering Cancer Center in New York City. In her role, she focuses on enhancing the research and clinical expertise of nurses. She holds positions at several other universities, including Professor Emeritus at the University of Missouri St. Louis. Margaret is extremely dedicated to understanding the challenges in under-resourced areas and for underrepresented minorities. Just a few of her numerous projects include helping develop a nurse-run breast cancer screen intervention in rural Nigeria and teaching a cancer chemotherapy in Kenya. Margaret is also a retired colonel in the U.S. Army Nurse Corps of the Massachusetts Army National Guard. She previously served as president of the Oncology Nursing Society. Please accept our warmest congratulations, Dr. Margaret, as she became affectionately known throughout Africa. Next is Sandy Cayo, nominated by NYU Rory Myers College of Nursing. Sandy Cayo is a clinical assistant professor at New York University Rory Myers College of Nursing. Her research interests focus on social determinants of health and improving access and overall health outcomes for African American patients. She serves as mentor and advisor for various student groups, including Student Nurses for Advocacy and Policy, Black Student Nurses Association, and Nursing Students for Global Health. She currently serves as the Director of Education for the Health Education Action League in Haiti. In her work in Ghana, Cayo serves as the Director of Quality Improvement and Partnerships for Amazing Grace Children's Foundation. She has worked with NYU dentistry leadership and NYU nursing students on 4 quality improvement projects focused on child and maternal health in Ghana. She's currently completing her PhD at Duquesne University on a project focusing on secondary data analysis from the Jackson Heart study to better understand the relationship of stress, perceived discrimination, and blood pressure management in African American women. Sandy, we share a mutual love for Haiti, and I'd love to hear more about your work there, possible collaboration in the future, perhaps. And as they say in Haiti, merci en pile, and big congratulations. Next nurse honoree is Fatimah Dar Odeh, nominated by the Holy Family Hospital in Bethlehem. Fatimah Dar Odeh was born and raised in Dahesha, a UN refugee camp in Bethlehem, and now resides there with her husband, 2 sons, and daughter. When Fatimah began her nursing career, she was placed in the postnatal department and loved caring for recovering mothers and their newborns. She remained in that department for over 11 years. In 2001, staff changes at the hospital led to Fatimah being transferred to the operating department. She was excited for the new, faster-paced work environment. Holy Family Hospital is a Catholic teaching maternity hospital and was established as a primary work of the Order of Malta at the request of the late St. John Paul II. Because Fatimah is a refugee, when other refugees come to Holy Family Hospital, she is easily able to be attentive to their needs and put them at ease, and they are much more trusting of her. Employees like Fatimah are essential to ensuring that refugees receive the health care that they need with dignity. Thank you, Fatimah, for all you have done and continue to do. Congratulations on this award. Our next nurse honoree is Jennifer Dohrn, nominated by Columbia University School of Nursing. Jennifer Dohrn is the Associate Professor and Assistant Dean for Global Health at Columbia University School of Nursing. She serves as the school's director of the Pan American Health Organization, World Health Organization, Collaborating Center for Advanced Practice Nursing. Jennifer has worked as a nurse educator and nurse midwife for more than 2 decades. She has worked in sub-Saharan African countries since 2003, helping to expand the role of nurses and midwives in primary and HIV care. In addition to her many contributions to HIV care and prevention, Jennifer serves as a principal investigator for a study on the health needs of Syrian refugee women living in the Jordan. Jennifer has had long-standing collaborations with the Centers for Disease Control and Prevention, the Consortium of Universities for Global Health, Global Alliance for Nursing and Midwifery, International Council of Nurses, International Confederation of Midwives, and the WHO, World Health Organization. Let me remind everyone that last year, 2020, was declared the Year of Nurses and Midwives. Thank you and congratulations, Jennifer. Next, we have Diana Dowdy, nominated by Rad Aid International. Dr. Diana Dowdy is a certified nurse midwife and registered OBGYN sonographer who has worked in clinical practice for 40 years and currently chairs the ARDMS Midwife Ultrasound Exam Committee and sits on the American College of Nurse Midwives Ultrasound Education Task Force. Diana's most recent nursing faculty appointment is at Vanderbilt University. She's been a longtime advocate of integrating point-of-care ultrasound into clinical practice and became one of the few dual-certified CNM RDMS professionals in the country. She developed an accredited women's point-of-care ultrasound curriculum, which she teaches to both nursing and medical professionals. Diana's overseas work includes under-resourced locations in the Caribbean and Africa. In 2019, she was appointed co-manager of Rad Aid's nursing program in Grenada, where she conducted obstetric and ultrasound training for midwives and house staff. In May 2019, she was recognized as a fellow of the American College of Nurse Midwives, the organization's highest achievement. Another nurse midwife, bravo to you, Diana, and big congratulations. Just a side note on this nominating organization and one of our sponsors since our inception, Rad Aid International. They have generously offered to support all our international attendees from developing countries. A huge thank you and shout out to you, Rad Aid. And Diana, a great nurse from a great organization. Thank you. Our next nurse honoree, Ann Peach, nominated by the Order of Malta American Association. Ann Gallagher Peach, Vice President of Future Vision Group 2, serves as a nursing consultant for educational institutions as Senior Clinical Leader, HRO Transformation for Healthcare Organizations. Ann has over 35 years' experience in senior management positions, including serving as Vice President of Patient Care Services and Chief Nursing Executive for the Orlando Health System, Chief Operating Officer of MD Anderson Cancer Center in Orlando, and Executive Director of the Dr. P. Phillips Hospital in Orlando. Ann spent the first part of her career as a critical care nurse and a clinical nurse specialist with an expertise in pulmonary nursing. She currently serves on the faculty at the Institute for Healthcare Improvement. Ann is a Rotarian and has worked on several international projects. In 2016, she was installed as a dame in the Sovereign Order of Malta and volunteers annually as a nurse in Lourdes, France, caring for the sick. She currently serves on the Board of Counselors for the American Association Order of Malta. Additionally, she serves as the Minister of Sick at Dr. P. Phillips Hospital and lay Eucharistic minister at Holy Family Catholic Church. Ann is also a volunteer for Give Kids the World, where she welcomes the Make-A-Wish Foundation children at the airport and works as a volunteer at the village caring for the families. I personally have had the privilege of knowing and working with Anne over many years in Lourdes, a very special place where we've brought thousands seeking physical, emotional, and spiritual healing miracles. This is where I witnessed firsthand Anne's total selfless love for others. Congratulations, my dear confrere and friend. The next nurse honoree is Tammy Higgins, nominated by Western Connecticut Health Network. Tammy Higgins is an advanced practice RN with almost 30 years of clinical experience in primary care, college health, hospitalist, education, critical care, and cardiology. For the past 14 years, she has served as a cardiac specialist in the Department of Interventional Cardiology, managing the pre and post procedure unit at Danbury Hospital. She is currently the coordinator of the newly organized Transition of Care Office for Western Connecticut Medical Group. Tammy is a strong believer in giving back to the community. In 2015, Tammy coordinated an event that involved more than 300 participants from the greater Danbury area entitled Hands for Life, where she arranged to teach community members the life-saving skill of hands-only CPR. Acting on her strong passion for global health initiatives, she has participated in 8 medical mission trips thus far, working in Kenya, Haiti, Uganda, and China. She actively fundraises for the nonprofit organization Hearts Around the World and is now on the steering committee for Nuvant's Division of Global Health in Nursing. Since we celebrate this event around our founder's Florence Nightingale's birthday each year, I feel it's very appropriate I share that Tammy received the Nurse Nightingale Award in 2016. Tammy, Flo is very proud of you, as we all are. Congratulations. Next honoree is Shannon Hillyer, nominated by Becton Dickinson and Company, BD. Shannon Hillyer joined BD Medical in 2013 as a clinical consultant in the New England region and became the clinical area field trainer for the East Coast, as well as winning Clinical Consultant of the Year. After excelling in customer education and training, she shifted her focus to the expansion and creation of customer solutions programs, landing her the Clinical Solutions Manager role. Shannon was one of the architects of BD's Vascular Access Management Program, an integrated solution aimed at assisting customers in reducing vascular access complications. She partnered with key healthcare institutions across the U.S. to quantify the impact of improving clinical and economic outcomes associated with vascular access management and supported their evidence generation effort to continue to shape the way clinicians deliver care at the bedside. Shannon has been the recipient of the MPS Clinical Impact Award and received the Global Marketing Value Offer Award 2 years in a row. Shannon now works in a global role, bringing the vascular access management solution to developing regions around the world, particularly her work in Latin America. Thank you, Shannon, and congratulations. Next nurse honoree is Samantha Hodge, nominated by the Catholic Medical Mission Board, CMMB. Samantha Hodge has been a registered nurse for 5 years. She worked for 3.5 years in the emergency department at Boston Children's Hospital prior to pursuing her passion for global health. Her passion for helping others continued to be ignited as she became a travel nurse in El Salvador and Rwanda. Samantha volunteered with the CMMB for 7 months as a pediatric nurse at Mutamo Mission Hospital in Mutamo, Kenya. She fulfilled a 3-fold nurse: inpatient nurse to adult and pediatric population, nursing mentor and educator, and community health nurse. She currently supports the emergency department at Children's National Medical Center in Washington, D.C. Big congratulations, Samantha. Next nurse honoree is Maria Teresa Lira Correa, nominated by Preventive Cardiovascular Nurses Association, the PCNA. Maria Teresa is a registered nurse midwife, and cardiovascular specialist from the Universidad Católica de Chile. Excuse my poor pronunciation. With postgraduate training in cardiac rehab, research, and statistics. Currently serving as the Executive Secretary of Clinical Research at HCFA Hospital in Santiago, Chile, Maria has worked for more than 20 years in cardiovascular risk reduction and community prevention. Maria is well known for emphasizing the role of nurses in cardiovascular prevention and risk reduction, administering community-based programs, and coordinating national awareness campaigns. A tireless volunteer, Maria liaisons with the Preventative Cardiovascular Nurses Association International Nurses Community, the Global Cardiovascular Nursing Leadership Forum. Maria also serves in the Chilean Cardiovascular Nursing Society as the president of the scientific committee. Maria additionally lends her expertise to the World Heart Federation, International Council of Nurses, European Society of Cardiology, and Association of Cardiovascular Nursing and Allied Professions. Big congratulations, Maria Teresa. Our next nurse honoree is Cathy Miller, nominated by the Arnold P. Gold Foundation. Dr. Cathy Miller is currently an associate professor at the University of Texas at Tyler and a research professor at Texas A&M University Corpus Christi. In 2010, she joined Shared Hope International as a fellow before becoming their healthcare consultant and trainer in 2014. Cathy also has 20 years experience as an ER, ICU, and trauma registered nurse, has acted as a director of multiple departments and as a critical care flight nurse. She is also founder and president of Miller Healthcare Consulting, serving as subject matter expert for various law firms and the U.S. Attorney's Office, Southern District of Texas. Cathy recently received honorable mention for the Pearl Birnbaum Hurwitz Humanism Healthcare Award from the Gold Foundation. Cathy is currently the co-chair of the Texas Coastal Bend Border Region Human Trafficking Task Force and a founding steering committee member of the Global Anti-Human Trafficking Task Force initiated by the UN in November 2018. And most recently, Cathy served as the Director of Research and Scholarship for the Global Strategic Operatives for the Eradication of Human Trafficking. I personally have known Cathy over the last decade as our paths cross frequently in the anti-human trafficking work. It's now such an honor for me, not only to bestow this honor to her, but to work closely with her as she provides the evidence-based research we need to share with health systems around the globe when it comes to human trafficking. A very well-deserved award, Cathy, and big congratulations to you, dear friend. Next honoree, Marian Nowak, nominated by the National Association of Catholic Nurses, USA. At the age of 19, Marian Mimi Nowak, as she's well known, was one of the original volunteers to serve the homeless free meals at the Cathedral Kitchen in Camden, New Jersey. In the 70s, while working in the Thomas Jefferson University Emergency Department, she developed the first patient discharge education program for underserved patients in the city of Philadelphia. Also at that time, her rudimentary computerized pamphlet system became the precursor to the computerized discharge planning system seen in many emergency departments. Mimi additionally lends her expertise to the World Heart Federation, International Council of Nurses, European Society of Cardiology, and Association of Cardiovascular Nursing and Allied Professions. She is also past president of the National Association of Catholic Nurses USA and an NGO team representative to SICIUMS, an international Catholic nursing organization with status at the United Nations. Marian Nowak is currently Pan American president for SICIUMS. Indeed, Mimi is a selfless and effective community servant, clinician, and scholar worthy of respect, renown, and admiration. Continuing in her selfless mode, she is currently a candidate to become a member in the Order of Malta, where she will commit to serving the sick and the poor while defending and giving witness to her faith. This is where I proudly know Mimi, as I'm her sponsor. Congratulations, Mimi, so well deserved. Next is Patrick D. Smith, nominated by Villanova University College of Nursing. Patrick Smith is a public health nurse who currently works at Fenway Health in Boston, Massachusetts. Patrick, that's my hometown. I hope you're a Red Sox fan. In his position, he manages and supports clients with acute illnesses and chronic conditions such as HIV/AIDS, diabetes, hypertension, and substance abuse. As a Fulbright awardee, Patrick worked with Partners in Health in Lesotho, where he developed and implemented a mixed method study of community health workers, impact on the accessibility and quality of healthcare to HIV and tuberculosis patients. This culminated in the authorship of a 30,000-word report to support advocacy and national CHW policy improvement. After Patrick completed his Fulbright grant, he stayed and continued to work with Partners in Health. Patrick is interested in health policy to improve health for the world's most vulnerable. Patrick is one to watch in the future, everyone. Congratulations, Patrick. Next nurse honoree is Pamela Sutherland, nominated by Hackensack Health. Pamela Sutherland was born and raised in Jersey City, New Jersey. Pamela studied nursing at Seton Hall University and graduated with a Bachelor of Science in Nursing. After she earned her BSN, she moved to New York, where she had a calling to help the underprivileged and underserved in Newburgh. In addition, she has dedicated the last 22 years commuting from New York to New Jersey to care for the adult oncology stem cell transplant patients at Hackensack University Medical Center. While working at Hackensack, Pamela committed herself to becoming the best nurse she could be to her patients in the community through a lifelong journey of education. She decided to obtain 2 more degrees at Seton Hall University, a Master's of Science in Nursing Administration and a Master of Science in Nursing Adult Primary Care. Pamela has continued her journey to achieve her nurse practitioner degree so she could provide primary care to the oncology stem cell patients. Pamela is the type of nurse I hope to be cared for by someday. Big congratulations, Pamela. Next nurse honoree is Martin Viegas, nominated by Becton Dickinson and Company, BD. Martin Viegas joined BD as a vascular access clinical consultant in 2014. He is a second career nurse, having had a 14-year career as a New York City police officer and was a first responder on 911. We all thank you for that, Martin. Marty began his nursing career as a staff nurse in the pediatric intensive care unit at the Morgan Stanley Children's Hospital of New York Presbyterian in New York City. Marty held positions as head nurse, clinical coordinator, nurse educator, and director, with the primary focus in pediatrics, pediatric intensive care, pediatric OR, and pediatric emergency medicine. He holds national certifications in critical care, pediatric emergency medicine, and infusion nursing, as well as being a basic life support and pediatric advanced life support and pediatric emergency nurse instructor. Thank you, Marty. Big congratulations to you. Our final nurse honoree today that we recognize is Mariekarl Vilceus-Talty, nominated by RWJ Barnabas Health. Mariekarl assumed the role of president and CEO of the Partnership of Maternal and Child Health of Northern New Jersey just in February 2021. She had previously served on the partnership's board of trustees. Prior to this, Mariekarl joined Jersey City Medical Center in July 2014 and began leading many paradigm-shifting incentives, which assisted in altering the landscape for staff and the larger maternal child health community. Until recently, Mariekarl was the Senior Director of Nursing and Patient Experience at Jersey City Medical Center, RWJ Barnabas Health, overseeing a team of 700 employees focused on patient safety and improving care. Her broad career spans 32 years within aspects of maternal child health, with roles as a staff member, leader, and clinical professor. Mariekarl is passionate about improving maternal health outcomes with strong emphasis on improving health equity, advancing social justice, and preventing human trafficking. She has been recognized numerous times for her clinical excellence and leadership. She received an MA in Nurse Executive from Columbia University and a BS in Nursing from Adelphi University. Mariekarl is a member of numerous professional organizations, and her commitment to public health spans internationally as well, where she serves as a chairwoman of Mission Grandbois, a private nonprofit foundation started in 2009 by her family. The organization's mission is to change the narrative of the Grandbois community through education, health, and financial literacy. I've personally had the pleasure of working with Mariekarl as she led her hospital as the clinical leader when we brought human trafficking training to Jersey City Hospital. Her leadership skills are second to none. Congratulations, Mariekarl. It's an honor for me to give you this award. And next, we will hear from our first guest speaker, Miss Alyssa Ladd, who is not only an assistant professor at the Mass General Institute in Boston, Massachusetts, but also was the Nursing with Global Impact awardee in 2009 when she received the Inspiring Global Nurse Award. She has an exciting presentation on frontline nursing